Hello everyone. For today, I'm going to talk about cough and sore throat. So cough in Tagalog, ubo, and sore throat in Tagalog ay pananakit ng lalamunan. So for the cough, there are two types of cough, the productive and non-productive cough. When we say productive, ito yung may plema. It is viral or caused by bacterial infection. It has mucus or sputum or plema nga. While non-productive cough, ito yung ubo na walang plema. It is a gag reflex due to irritation of respiratory tract. Again, it has no phlegm or mucus, but it has itching with throat. So for the treatment, sa non-productive cough o walang plema, gumagamit tayo ng mga anti-tussive o cough reliever. Sa productive cough naman, gumagamit tayo ng expectorant, mucolytics, para mailabas yung plema. Pwede ring antibiotics upon prescription. So moving on naman sa sore throat, it is commonly caused by a viral infection such as cold or flu. It can also be an allergic reaction. For its treatment, NSAIDs or non-steroidal anti-inflammatory drugs. Example nito ay ibuprofen at naproxen. Pwede rin gumamit ng antibiotics upon prescription. So, kapag more than 10 days na yung ubo o kaya naman may fever na rin at red mucus, refer to a physician. Acute cough, considered kapag 2 to 3 weeks, and chronic cough kapag greater than 8 weeks na. So, example ng gamot na ginagamit natin for dry cough, Tuceran Forte. It contains dextromethorphan hydrobromide, which is an antitussive. It also contains phenylpropanolamine hydrochloride, which is a nasal decongestant, and paracetamol, which is antipyretic or pain reliever. Antipyretic means anti-fever. So, ito ay binibigay 1 capsule every 6 hours for dry cough. Next, we also have strepsils. Ito yung mga throat lozenges which have dichlorobenzyl alcohol. Next, for productive cough, we have guaifenesin. It is an expectorant. Okay, so that's all. Thank you.